Welcome to Therapist Confidential, a psychotherapy.net podcast. And now, here's your host, Travis Heath.
Hello, everyone. Welcome back to the Therapist Confidential podcast. I'm your host, Travis Heath, and today we are joined by David Prucha. And I'm really looking forward to this conversation. I think it'll be fascinating because we'll talk about some perhaps paradoxes in psychotherapy. And what I mean by that is sometimes the response that might feel, most natural, that's a tricky word, natural, but the response that might feel most natural, say like compassion, caring, the way that we do that could sometimes unintentionally undermine the work, right? And so that brings up interesting questions about trusting our instincts. Are there times to override them? Developing clinical wisdom, and maybe when we do that, do we resist the urge to rescue, to reassure, to comfort, which in some ways, most of us who get into this field, that might be part of our nature. So those of you that listen to the podcast know that I like interesting, new, unconventional ideas, and I think we will have plenty of them today. David, welcome to the podcast.
Yeah, Travis, thanks so much for having me.
Would you mind just giving us a little introduction to you? I don't like reading stale bios, so anything about your professional work, anything you want to share about your life that might help the listeners come into knowing you a bit better.
Absolutely. So I like to start just saying that I'm a husband and a father of a 7-year-old and a 5-year-old, and I am a psychotherapist. I tend to think of therapy in some ways how I think about other crafts. So whether that's like musicianship or whether it's painting or artistry of any kind, that ultimately I think of a craft as something you love enough to disappear for. So there's this sense that you have to walk into the woods and go away. You have to immerse yourself deeply in something and embrace some anonymity for a time. And so therapy for me, much of how I think about it has been shaped over the last 20 years, I would say by 4 different places that I've disappeared into. And I say 20 years, I've been practicing for 15, but I think the journey starts 5 years before that. I moved to Los Angeles and I worked on Skid Row for a time. So, for those who don't know, Skid Row is 50 city blocks of somewhere between 6 and 8,000 people on any given day who are living on the street. And I worked in the rescue missions there. And then I would also just wander the streets in the day. So, I had a friend who would drop me off at 7 in the morning and then pick me up at 5. And I just became interested in the question of how do I help people who are understandably suspicious of me? And there was plenty of suspicion to go around. The people who were living on the street thought I was an undercover cop, and the undercover cops thought I was buying drugs from the people who were living on the street. But it was a really valuable experience where I started exploring ideas of uh, not necessarily how distance gets in the way of helping people, but how sometimes distance is how people protect themselves, and it's an essential quality of being of help. And so I did that for a time. I went to grad school afterwards. And then the second place I got lost in was a maximum security facility for kids aged 15 to 21. And predominantly, I worked with people who committed violent offenses and were oftentimes gang members. And I worked with them and their families. And you can imagine the clinical environment there was like a 10 out of 10 in terms of difficulty, and I was like a 1 out of 10 in terms of ability. So it was a really steep hill, but for that reason, like a really great experience. The third place, emergency rooms and intensive outpatient programs, just doing like really raw therapy. I would say like high stakes therapy from a client safety perspective. And then about 4 years ago, I started working with clients in the corporate space, which felt like a real change in direction. When I started, I was not sure how I would feel about it, but honestly, it's been really lovely. Half of my job, I see about 100 clients a year. And many of them are here on work visas and have no experience with therapy whatsoever. And then the other half, I do clinical consulting. So putting my head together with other therapists and trying to help them help their clients. I should add, uh, more recently, I've just been thinking about intuition and its role in therapy, how it's defined, what its limits might be. what intuitive updates might be useful. And that's sort of the 20-year arc and the places that have shaped how I think about therapy.
Wow. Uh, I love the idea of disappearing for a time. It has me contemplating, like, where are the places that I've disappeared to? I love that framing. I've never heard that before. And then I loved when you said, you were learning how to help people who were suspicious of you, um,
Yeah.
understandably suspicious of you. And I just generally love the diversity of the sorts of folks you've been working with.
Yeah.
Um, I feel like that often isn't what happens in the field.
Mm.
There are exceptions, of course, and I don't think it's people's fault, actually. I don't think that that's like the trajectory people get after their finalized training. It's sort of like maybe work at a community mental health center to get your hours or something, but you want to try to get into private practice, and you want to try to work with people who, what do they say, the wounded well or something like this.
Yeah.
People who might score not as high on psychology and psychiatry's measures of psychopathology, right? And
Mhm.
so what's interesting about your experience is it's so varied. Was this by design, or did it just sort of happen?
I think it just sort of happened. I mean, I when was 20 and moved to Los Angeles, you know, I struggle with what the honest story is there. I know for sure a big part of it was I wanted to help people. That's always been something that I think has uh, reduced the sort of existential ache that I experience. That when I've drawn nearer to people who are struggling, I have more reassurance that my life matters in the way that I hope it will matter. So there's that, like, more poetic view of it. I also just wonder when I was 20 if I was just watching too much Training Day. Uh, and so I don't know, like, sort of how to sort of assign what motivation to what percentage there. But despite whatever my like initial motivations were, I found it so captivating and meaningful. And I found the relationships that I met there to be so important to me and the work to be so gratifying. And then I think that was connected to working in the maximum security facility when I was down on Skid Row. A lot of the people that I was working with down there were gang members, and so a big part of it was like it just felt like there was a natural transition there. Like, oh, I want to help people. What's the way to do that? Okay, I'll become a therapist. Okay, but what I've done in the past is not really traditional therapy. Um, I'm not looking for sort of like the leather chair in the private practice so much. And so uh, there was just sort of a through line between those experiences. And then I think the ER and intensive outpatient program stuff was, again, I think for a time I was just attracted to intensity. My experience is when there's a little bit of danger, I learn quicker. When the stakes are higher, I'm forced to come up with solutions that maybe I'm just not smart enough to come up with if I feel safe. And so I think that some of it has just been that when I'm in a higher pressure environment, I find the learning curve more fulfilling. I have to sort of add stress to extract the lessons. And then I think the sort of corporate client work, which is remote, I think that part of that was shaped by just becoming a parent, honestly, and realizing that some of those environments where there was more danger, I felt a shift in myself where I didn't want to take on the same degree of risk when I had these little ones to look after. So I feel lucky that it's been as fulfilling as it was, but I think that that fourth environment was really just practical.
Interesting. I could keep going on this trajectory, but I'm going to resist and pivot just a little bit.
Yeah.
So you mentioned it just a couple of minutes ago that you're kind of toying with this idea of like intuition, clinical intuition. Some people might call that, like instinct. And, I think you can tell me if I'm wrong, that your sense is that sometimes this can backfire and it maybe isn't as useful as it might seem, even counterintuitively. So I'm wondering if we could start, what first led you to start noticing this pattern? Was it in your own work? Was it in the work of others? All the above? Where were you first coming into contact with it?
Yeah, I think most of my lessons, most of the things I think about in therapy come from my own mistakes. So I think, like most therapists, I have this habit of facilitating the conversation while like simultaneously watching myself facilitate the conversation. And maybe that's just like a holdover of graduate school where you're being recorded. Um, but there is this utility to that where when I would hit a pain point, I would try to go back and say, where did I get that wrong? And I think actually part of where I got this from was there was a really talented um, corrections officer of all people when I worked in this facility who was like a masterful de-escalator. And whenever there was like a situation that got out of hand, he and I would go on walks in the parking lot and role play it. And so we would just practice. Okay, when I say this, this is what happened. What could I say differently that would create a different effect? So there was always this sort of like discussion around how do I update and change what I'm saying to try to influence a different reaction on the person I'm talking to. So I think I pulled some of that into therapy as well. And I think that whenever I run into mistakes, I tend to ask, okay, where did that go wrong? And then the other part of it is when I watch video of other therapists, sometimes if I see something where I go, "Ooh, I make that mistake. Oh, I'm looking in the mirror right now." Then there's a sense of like, okay, this might actually be more of a universal difficulty. It's not just a way in which I'm uniquely bad at therapy, although those certainly exist. This might actually be something where there's a trap here. And so I tend to think of intuition as knowing what to do without knowing why. And I think of intuition, when you start describing its qualities, it becomes more clear. So this is something that happens quickly. I think intuition sprints, it doesn't walk. Intuition is something that feels holistic. So it's not segmented. It's like your whole body understands what's next. And then I think part of intuition is pattern matching. So there's this sense that like the past is sending information to the present and the past and the present are reverberating with each other in some way. And I think intuition even becomes more clear when you think about what it isn't. So if intuition is one style of knowing, another style of knowing is something like the analytical, logical style of knowing. And what are its characteristics? Okay, that style of knowing walks, it doesn't sprint. That style of knowing is segmented. It sort of happens above the shoulders or between the temples. And it's not always necessarily about pattern matching. It's about considering evidence and then trying to avoid contradicting ourselves so we can come to like a trustworthy conclusion. And one way of thinking about therapy is that it's traveling across 50 minutes and knowing when to follow your intuition and when to override it. And so these intuitive traps are moments where we should have, or I should have, snapped into an override of my intuition, but I followed it for reasons that, like you said at the beginning of the podcast, are oftentimes well intentioned, but then just lead to suboptimal clinical outcomes. So I'm also not saying like, some people have these ideas and they're like, well, you're going to create a real mess unless you sort of learn to update how you practice your therapy. I think I tend to sort of try to approach therapy with, in some ways, a lower stakes mindset, although sometimes it is very high stakes. I think really what we're talking about is that oftentimes these intuitive traps, they just lead to like suboptimal outcomes, but not typically catastrophic ones. And so that's sort of how I think about intuition and how I am trying to formulate it as I apply it to my own therapy.
Some of what you're saying reminds me of my friend Daryl Chow asking the question, where did I get that wrong? And I think that's a question that is hard for us to ask. We often like to ask the question, what did that other therapist get wrong? And we like to point that out. We're really good at that. Or why that other therapist's theory is not as good as ours. But the question, where did I get that wrong? It's a simple and lovely question, and also could be a difficult question, I think, for therapists to interact with. So I just love that idea that that's where this is coming from, looking at yourself, and maybe it's a call for all of us to ask this question when something takes a turn, we go, I wonder where I got that wrong. You're also sort of noting that, of course, all of us have our own idiosyncratic things that we get wrong for whatever the reasons are sometimes. But a lot of times these things are systemic, and sometimes they're baked into our training and we don't even realize that they are. And so we keep doing this thing over and over and over again because we've been taught to do it, but we haven't really scrutinized it. We haven't, asked questions of it, which I get the sense that you do that, which I really appreciate. And then this idea that, what a great line. By the way, David's a writer as well. This is where I first came in contact with his work. He's written some pieces for psychotherapy.net. You can check them out. But this idea of intuition sprints, it doesn't walk. That's a great line. And I resonate with it, not just because it's clever in terms of languaging. It is clever. But because, gosh, I noticed that in my own work. And I've noticed that like with students that I work with too, like, man, when our intuition takes off, it takes off. And there's some things that are wonderful about that sometimes. And then maybe there are some other things that, when something sprints, we might be missing something, as we're sprinting, even if we're doing some other things that are great. So, gosh, the framework you're describing, I really appreciate. Now, here's something I'm wondering.
Hmm.
How do we begin to distinguish between a therapeutic intuition that should be trusted and one that should be overridden? How do you make sense of that?
Yeah, that's a really great question that I don't know if I know the full answer to it, other than to say, I think what I'm looking for is when something feels right clinically, but I'm reliably getting outcomes that aren't working, then I start to doubt the intuition there. And and so I think the intuitive traps, and this is just how I'm sort of like mapping this for my own therapy, they might actually be different for each therapist. And actually, my guess is that they probably are. And there might also be different intuitive traps just based on like the course of therapy. Like, so there might be traps that happen more reliably in the beginning, in the middle, and then the end. And so when it comes to like, how do I know if I've followed my intuition off of a ledge? I think in some case, the answer is in the client's responsiveness to the intervention. And not always. Sometimes a client has an uncomfortable response to our intervention, and that discomfort is actually valuable if it has a clinical purpose. But I think when I fall into a pattern of behavior with clients and I seem to be getting a universal or uniform response, some signal from them that that didn't quite land, or I'm not really sure where to go there, then I start trying to turn the mirror on myself and I say, like, all right, let's actually imagine that my uh, intentions are good, or let's try to imagine that maybe what motivated me wasn't something malicious or awful. And I don't mind looking at that either. But as a starting place, it can also just be true that even though I'm trying my best and even though my intentions are good, it's not landing in the way that I want it to. And so it just requires evaluation. So I don't know. That's sort of a circular or sort of roundabout answer to your question there. I don't know exactly the full answer, but my sense is that if I continue getting responses from clients that aren't moving the ball forward towards their goals, but in my acting, it feels emotionally resonant to me, I want to be curious about that.
Mm. Okay, I love that last line. I want to be curious about it because I think more often we are less curious about it and we get into more of a rationalization mode, and that can be dangerous. And it can happen quickly without us really noticing. And instead being sort of curious about the gap between what it's feeling like for you and what it seems like the results are that are occurring. Oof, man, I love that idea. Now, okay, you have, I think you've coined this term. If you haven't, I hadn't seen it before. This idea of compassion blocking. Super interesting to me. And my early sense of it, you can tell me if I've got this wrong, of course, but there seems to be something, and this is one of those things that seems to be systemic. We're not talking about like an individual therapist, but our collective helping mental health fields seem to equate compassion with reassurance and sometimes often very quick reassurance. And I think that that's kind of at the center of this idea of what you call compassion blocking. And I'm wondering if you can educate us a little bit more about this idea. And, because it's interesting, like at first glance, if we're not curious about this, well, yeah, of course, we want to reassure somebody's suffering. And in some ways that almost feels instinctual, especially for a bunch of us that are helpers. I don't know if it's actually instinctual. A lot of things get labeled instincts that aren't, but boy, for us, people that got into this to help, it often feels instinctual. So can you take us through maybe where we go wrong with this sometimes?
Yeah. So I think of compassion blocking is a rush to reassure that inadvertently blocks exploration. So let me say a little bit more about that. You can imagine a client saying something like this. Uh, so I was abused by my parents when I was very young. And despite what my friends say, I don't think I'll ever get over it. Compassion blocking would be if I were to rush in and say, well, I think that's really normal. Or compassion blocking might sound like, I can understand why you feel that way. So there's like a certain speed that rushes in and provides a reassurance. Now, the compassionate reassurance isn't necessarily the problem. It's that there's a period at the end of that reassurance. And so what happens is it puts the client in a really strange situation. If I imagine myself talking to a therapist and I were to unburden myself with something that had been really hard for me, and they just quickly came out and said, yeah, I think that's normal. There's this question of like, okay, how do I actually step into this conversation after that? So sometimes what happens is it just creates this empty silence because there isn't a follow up or a deepening of exploration. So if I wasn't compassion blocking, if I wasn't simply saying, I think that's really normal, period. But if I said something like this instead, you mentioned that your friends, they think you'll get over it, but you're not so sure. What is it that your friends don't understand about what happened? Or if I said something like this instead, if I said, you said this is something you'll never get over. Tell me specifically, what are the parts of this that feel cast iron permanent? If I were to actually deepen the conversation, now I'm in deep water with my client. Now I'm far off the coast. And I think in many cases, at least for me, that's what actually motivates the compassion blocking is I'm really fundamentally afraid of dumbfoundedness. I'm afraid of being in a deep conversation where I don't have the map. I don't know the answer. I'm not sure now that we're out here in this deep water that I can pull my client to shore. And what if they unburden themselves and they're so vulnerable in that moment and what they discover in me is that actually I don't have any help to give. And so I think part of what's happening is this fear of dumbfoundedness is what is motivating the compassion blocking in me. And if I can keep the conversation in shallow water, I'm safe there. Right. So it's like I'm reassuring the client, but really I'm reassuring myself. And I think that there's a way out of that, uh, which is we have to look at the difference between dumbfoundedness when it happens before exploration and when it happens after. So dumbfoundedness before exploration, if I compassion block and I give my client nowhere to walk, that is an empty silence. However, if I experience dumbfoundedness after I explore, that can actually be a form of validation. And here's how I mean. So if imagine I'm telling a therapist something that I've been carrying, and as soon as I share it, they snap into their recipe, their routine. They got a system for that. I might start thinking to myself like, oh, I guess this is bread and butter for this person. Like this is actually like pretty easy. Actually, maybe this isn't as big as it feels. But if I share what's going on with me and the therapist is stumped, oh, this actually is hard. Like I actually am going through something challenging. And so when dumbfoundedness happens after exploration, it can be a form of validation for the client. When we make that change in our mind, the conversational landscape changes because we can win in two ways. We can either win by being dumbfounded after we are pulled into deep water. That's useful. Or now that the pressure's off, we might actually find useful words. And so there's something about taking the pressure off of us that actually opens us up to more intuitive flourishes. But fundamentally, I think we have to understand it's true that silences can be empty, but they can be full too. And dumbfoundedness after exploration is a full, clinically useful silence.
A lot. I appreciate what you just said. One thing I'm noticing, and full disclosure, I'm probably attracted to this because I do something similar, you know? Like, I remember my dad saying when I was younger, it was lost on me then, that the measure of a person's intelligence is how much they agree with you, right? So we must be really smart. I'm so relieved.
Yeah.
But something I noticed as you started giving some examples of what you might actually do, which I really appreciate, because I think one of the challenges of being a therapist and not just a philosopher is that we have to take ideas and we have to put them into practice. And so I appreciate that you gave some examples of questions you might ask. The part I appreciate the most is that you were asking questions. In my formalized training, I was told we were not supposed to ask questions. Now, I'm more sort of narratively inclined in my work, and so there's a lot of question asking there. But I don't just ask it because it's some sort of narrative mandate. I ask questions because I found them to be really useful in understanding people and what they're up against in the world. And they don't know a better way to be curious than to ask questions. But in my formalized training, I was told don't ask questions, which was always struck me as bizarre. And I notice in both the examples you gave, you were asking questions, and they were rich questions. They were questions. I mean, I imagined where people might take them, those particular questions, and they could take them all sorts of different directions. You're almost assuredly going to learn something about the person you're in conversation with from the example questions that you gave. So I'm wondering if you can speak some to question asking and how that sort of fits into your work.
Yeah, absolutely. I think question asking is really uh, the byproduct of being curious in who you're meeting. Um, I certainly think there's a continuum of useful to unuseful questions that we can ask. But I also think that asking questions is a really great way of deepening conversation. It's also a really good way of signaling that we actually care about the person we're meeting. When somebody asks me a question and it's a specific question to what is going on in my life, there's a sense that it's a small gift. It's not like a stock packaged item. And I think questions actually draw us into more individualized therapy, that it just requires higher investment. You're not going to successfully deepen a therapeutic conversation by either avoiding questions entirely, these are my biases, or by asking canned questions. I think you really have to allow yourself as a person to bend forward and have questions that are tailor fit to the discussion you're having. And so not only do that, I think questions they're useful for the client to sort of explore and organize their thinking. But I also think they're useful because they push us personally into a position of investment with the client. And so, I ultimately think what makes therapy amazing amongst many things is that it's how we organize what's going on in our mind, that we're sort of in a position where things can feel like a chaotic bedroom, like, the dresser drawers are pulled out, socks are everywhere. And therapy is like the art of saying, let me hold this item up. Where does it go? Okay, I'll put it here. You can kind of organize it. Where does this item go? Oh, that goes in the closet, right? Oh, that goes in the dresser. And so I think that questions are also the beginning of helping somebody organize their thinking. for me personally, as an individual, like I think this is also a bias in therapy in many cases, is that we sort of undervalue the thinking space and sometimes overvalue the feeling space. And I think they should both be valued. And really, if you have somebody who's an overthinker, you want to drive them into their emotions. But if you have somebody who's an overfeeler, call it whatever that means, balancing with sort of a cognitive frame can be useful. But I think that ultimately, there's a lot of relief for certain types of clients if they can just arrange or put in order the chaos that they're experiencing in their mind. And questions are a really great way to help people arrange.
Mm. Yeah, it's a beautiful description. I was also struck by you using dumbfoundedness. I'm thinking like, I've never once heard, and I mean this sincerely, 20 plus years of doing this work, being in academia, clinician, all the things. I don't think I've ever heard anyone use the word dumbfounded to describe sort of what might be a useful outcome in the conversations we're having. And that I'm interested in just that idea, but also I do worry, and I don't think psychotherapy is the only profession where this happens, but language gets stale. And I do worry when we just use the same language over and over and over again to describe things that, after a while, it ceases to mean something. I mean, we can learn something from poets on that front. I mean, poets will just straight up create language. Like, why do they create? I've asked poets that before. Like, why do you create language? Well, because none of the language that we have quite gets what I want, and it's all become stale. And so I love the idea of bringing in language, bringing in ideas from outside of psychotherapy. So I just want to express my appreciation for your work in that regard. All right, now let me ask you this. I could imagine people listening to this and they're
Yeah.
saying, like, okay, cool. I get what he's saying. I think there's merit to it. But how do I balance this with a warmth, or in the lingo of the field, with unconditional positive regard? How do I balance these sort of imperatives that I was given about being a therapist with what it is that you're proposing, which is that rushing into compassion may actually work against the process of therapy?
Yeah. I think, I'm pro warmth. I'm pro compassion. I think it's really about, does the compassion serve to block the exploration or not? So there's nothing wrong with expressing compassion. In fact, I think there's something very right about it. It's just making sure that functionally it's not serving my needs for reassurance. It's not serving my needs to keep the conversation in the shallow end of the pool. And so this isn't about reducing warmth or reducing compassion. It's just about understanding that sometimes it hides something that's serving our interest and maybe not serving the clients. And so that's how I think about it is, if somebody, heard this conversation and said, David, just really not for compassion, I would go, oof, I have not communicated successfully. I, am- I am very much for that. And I feel that that is a vital part of responding to suffering congruently. Um, and so that's not the angle here. The angle is just exploring when compassion is blocking exploration, and understanding that exploration, we can feel safer to do that and to express compassion with whatever is unearthed when we understand that dumbfoundedness after exploration validates the client.
Something else I'm hearing in what you've been saying is that sometimes we engage in these practices, perhaps not just because it's what we've been taught to do systemically through our training, but also because it helps keep us in an area that feels less risky.
Mhm. Yeah. And I think some of that's just, and for myself, that can be motivated by a few things. One is like, maybe I'm uncomfortable because I'm worried I'm about to have a discussion I've never had before with a client. So it's like, ooh, this is rep one. That's always, just from a human standpoint, uncomfortable. Or two, like maybe I'm fatigued, right? Like maybe I'm on, the sixth client of the day or whatever. And there's, people have different thresholds I always found that mine is sort of like embarrassingly low. There's people who is like, yeah, I see 8 or 9 clients. I'm like, I'm so in awe of that, but that's not in me. But maybe I'm on session number 6 and I'm just fatigued and moving into a deep place. I just get the sense that that's really going to pull something from me that I don't have. So I think that there's a number of things that could sort of motivate this reaction and response. And ultimately, I think it's very human and understandable. But I think the goal is trying to keep the consistent focus on providing for the client a process that'll help them become who they wish to become.
Okay, so let's say there are some curious therapists listening to this, and I hope there are, and curious about themselves and going like, "Ugh, I wonder when I engage in compassion blocking." I mean, I suspect this is one of those things, like most critiques, that we might find it easier to point out in other people, but sometimes find it harder to recognize in ourselves. So if you have someone that's listening to this and they're like, I want to be curious about when I might be participating in this process, do you have any tips for them about what to pay
Mm.
attention to?
Sure. Yeah, I can at least just say what I notice in myself and hope that maybe there's some applicability there. It's when I'm nervous after hearing a presenting problem that often comes out. It's the client shares what they are hoping to work on, and I feel the nervousness of a new relationship, right? I feel the subtle evaluation that's occurring. Does this therapist know how to help me? Is this a place that I can be comfortable? I get the sense that I'm simultaneously conducting therapy and I'm in an interview. And so I think when I feel nervousness, and it's because the client has demonstrated or expressed something they want to work on, I've noticed in myself, I'm prone to engage in compassion blocking there. So, hey, I'm looking to work on X, Y, and Z. Ooh, how does my area of competency feel there? And in many cases, that's where I'll notice in myself, I'm rushing in. Oh yeah, well, I think that's normal. Like it's almost like I've seen this 100 times. There's this sense of like, let me just draw from my wealth of experience here. And I think in many cases, that's the place where compassion blocking emerges.
I want to shift to something that you call, again, this is a term I haven't heard before, appraisal bailouts, which is similar, but not the same thing from my understanding. So, and when I've read a bit about it, what you sent me, it's provocative. So
Mm,
I think the idea here is that therapists can often rush to rescue clients from what would appear to be like a negative appraisal of themselves.
mhm.
I have that right?
Yeah, yeah. So I think of appraisal bailouts as uh, when a client is working to understand their own role in a problem, that I rush in to bail them out of it. And so here's an example. So you can imagine someone saying something like, uh, when I get upset, I throw things at my spouse. And despite the promises I've made to myself and to them, I keep doing it. And the truth is, I'm just not trustworthy when I get upset. I feel this strong pull in myself to say something like, "Well, I don't know if it's fair to say you're not trustworthy." Right? There's this strong protective reflex that I have where, on the one hand, it's hard to hear somebody be hard on themselves. Like, there's a part of me, just as we're socialized, I think, it's a natural response to sort of help try to balance somebody's feelings of guilt with the places that they're innocent. And I think most of us understand that guilt and innocence are actually like not black and white concepts. I mean, they can be certainly, but in many cases, these two things drive together, which is why like two people apologize to each other oftentimes. But I think really what's motivating this is that therapists understand that guilt doesn't always come to us from nature with a safe level of calibration. So there's a continuum of destructive to constructive guilt. And I think we fear that we're in the presence of destructive guilt. And so we rush in to challenge it. So it does have the same quality in that there's a rush. But I think what makes this different is that what's really happening is we're not allowing the clinical picture to emerge to understand whether the guilt is destructive or constructive. Let me give a couple of examples of what I mean by that. So, like destructive guilt. I think most of us have met with somebody, say, who has a major depressive disorder, where despite having pretty rigid thinking in a lot of other areas, their mind is endlessly elastic when it comes to figuring out how to blame themselves for everything. So there's this like ability to find culpability everywhere. And that fertilizes the depression and just keeps the depression moving. It increases this sense of being a burden. And in therapy, when that shows up, the therapist, it's useful to join the client on a two versus one situation where it's like, you and I are going to argue with these thoughts that are unfair. And then eventually you'll learn to argue with them independent of me. So there's like this cooperative argumentation that exists in the heart of that treatment. So when that type of guilt shows up, this is actually a symptom that needs to be addressed. Now, move halfway up the continuum. We're not necessarily in a constructive place, but we're not destructive either. Sometimes guilt shows up because it is a misplaced emotion, meaning sometimes what happens is people are actually in a situation where they are powerless, but the mind will opt for guilt rather than powerlessness. And so here's what I mean by that is that guilt says, I could have done X, but I didn't. Powerlessness says there was nothing I could do, so I didn't do anything. So guilt actually smuggles in agency, right? Like there's actually a sense of like, I could have, right? There's actually a weird, in some forms of guilt, there's like a little hope in there in a strange way. But I think that in those situations, it's also clinically useful to say, hey, maybe what we have to do is explore how to relate to this powerlessness successfully and usefully. Now, let me move to like further up the continuum to like constructive guilt. Sometimes I think constructive guilt is the first step to relieve moral pain. Now, by moral pain, I don't mean that I, as a therapist, am foisting my values onto a client. I think we all know how dangerous that is and how many bad places it can lead. What I mean by moral pain is when I mistreat somebody in my life and I'm suffering because I don't understand how I got there and I don't know how to fix it. And moral pain is something that is also connected to self trust or guilt. Actually, there's a through line between guilt and self trust, which is that if this guilt is channeled constructively, I can understand how I hurt somebody. I can understand how to fix that. And then I can step back into relationships with my shoulders dropped a bit because I have a sense of like how to avoid that in the future. So, an appraisal bailout, when we do that in that third scenario where the guilt could be constructively used, what we're doing actually is standing between the client's moral pain and their ability to trust themselves. And so I think that the trick is figuring out, okay, I have this murky water and I don't know what the guilt is, right? Is it destructive? Is it somewhere in the middle? Is it constructive? And the appraisal bailout is less than useful, especially in cases when the guilt could be potentially constructive and could lead to increased self trust in the client.
Yeah, what I really appreciate about this is the way it's not taking the word guilt for granted. I think we do this a lot as therapists. We assume a uniform definition to a word, and I think with guilt, my anecdotal observation in doing this the last 20 or so years is that if we're not careful, we immediately associate guilt with bad. In other words, if someone's experiencing guilt, we need to get rid of this guilt for them, or it's unfair. And by the way, like you're pointing out, there's a continuum. Sometimes it is. I mean, sometimes, people are taking personal responsibility for things that systems have put on them, right? And so I think that's one variance of this. But one place where I've struggled with some of my narrative brethren is like, yes, this happens in systems. You won't find anyone who will talk more about systems and their influence on people than me. And also, I think sometimes we do this in a way that can strip people of their agency, unwittingly. I don't think anyone's trying to do this on purpose. They're coming from a good place, right? But now we're taking people's agency. And if you think about this from a narrative lens, I mean, a character in a story that loses their agency around a topic, I mean, uh,
Yeah.
where does the story go from there, right? And that's, and I think about therapy often through stories, and there are many characters in stories, not just the person we're working with. Perhaps they're the main character for us, right? There are many different characters, and if that character loses their agency in some way, especially because we're taking things for granted and how we're making sense of their situation. Now we've tried to do something really good, right? Good, bad is that's a lazy language, but we've tried to do something that's useful and helpful to the person, but unwittingly we may have actually stripped them of their agency, if that makes sense.
Yeah, I think that that's such a profound point. I think that one of the things that struck me and sent me my thinking in a direction was how I'm way more uncomfortable considering the usefulness of guilt in somebody else's life than I am in my own. Like in my own, it's like, oh no, I can handle guilt, right? I understand like I'm not perfect. I understand that something pinches me when I'm not in alignment with who I want to be. And I can see how I could use that as a motivational source, not to self punish, but to modify. And I could see how that would be useful. And then there's a part of me that goes, yeah, but how about for other people? And I go, no, 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 no. Right. There's like this thing in me that wants to protect that. And so I think that's another optical illusion that just needs like careful paying attention to, which is like you said, there are so many reasons where somebody might absorb guilt that isn't theirs, right? There's a lot of times that that happens, whether that happens in a family, in a workplace, in a society. There's a tendency to personalize where we shouldn't, but also there's other versions of this emotion too that have a useful purpose. And and so I think that the trick is figuring out, okay, how do I get out of that particular intuitive trap? And my mind goes, I think we just, for my own practice, I have to learn to appreciate clinical waiting. And so this is not a waiting of passivity or a waiting of inaction. It's a waiting of data collection for a sort of cold way of putting it. I'm trying to understand with time, am I dealing with somebody who blames themselves where they shouldn't? Am I dealing with somebody who's only looking at themselves for the first time? And there's some people in their life that wish they blame themselves a little bit more, right? Like, what exactly is the clinical picture here? And I think that waiting is hard because in some cases, we don't get to reassure the client quickly that will be of use. So that's another way of saying waiting comes with temporary reputational damage. So to let a 50-minute slump occur where the client is going, I don't know what I got out of that. And they're going to their family and going, I'm working with this guy, David. Honestly, I'm not sure it's worth the money. Like, okay, I told him what's going on. He hasn't really introduced too much of value yet. There's a sense that good therapy often requires temporary reputational damage. And so I think that that's what makes clinical waiting really hard is I have to be the facilitator in the room that says, you might not know my value yet, but that is less important to me than knowing what to do with your guilt. And so I think that that's really the way out of this intuitive trap is I hear somebody exploring their role in a problem. I restrain the appraisal bailout. And then I work to seek more information about what's occurring. And only when I feel like I have a relatively high sense of confidence that is this guilt destructive, somewhere in the middle, constructive, then do I permit myself to proceed. But I think until then, I just have to take the reputational blow on the chin. And I have a sense that we can do good therapy with a good reputation, but sometimes great therapy requires an imperfect reputation, and we just have to make peace with that.
Ugh, man, I love that. temporary reputational damage. I think that's something that all of us at some level or another don't want. It's a hard thing to tolerate. Um, and also, I feel like, if you think about this in other areas of life, if we're doing everything to make sure we uphold a good reputation, sometimes that works fine. But there are going to be moments where we might have to do something, stand up for a matter of principle, whatever it is in life, that's going to be unpopular and it might hurt our reputation. Now, ultimately, each person has to decide when they're going to do that and why and for what reason. But I've never really heard that applied to therapists. And
Mm.
the way you're talking about it is like, yeah, in order to do great therapy, as you were saying, there are going to be times where we might have to put that reputation to the side a bit and live with that discomfiture. And I'm thinking the best therapists I know, the ones that I respect the most, here's what I hear them say most often. I swear to you, I have friends that say this, that are therapists that say this frequently, and the best ones say this the most. Like if you're just talking with someone, hey, how did that session go, the chat? I don't know. I don't even know if I'm doing anything for them, to be honest. Like we'll see. But what's interesting, what goes along with that is, one, the willingness to tolerate that sort of ambiguity and be like, I'm not sure if it's working. But also there's this sense of patience. Like they'll say, they don't use the word yet, but it's implied in there. It's like, well, I don't really know if I'm doing anything. I don't know if it's working, ... yet, right? Because they're patient with it, right? They give it time to unfold. And so this takes me all the way back to something you were saying near the beginning. Intuition sprints, it doesn't walk. And gosh, we're in a world where stuff moves so fast, faster than ever. And I found even in the last 5 years, that's happening. Clients want that out of therapy too. It's like, fast, give me the tool, and I've just started telling people flat out, I'm not a tool guy, so I don't really have the tools for you. Like there are people that do, but I'm not good at that. Like I'm not going to be able to give you the tool or the intervention. Like I'll have a conversation with you and I can do that and I can ask questions. And I feel like my area of expertise is to ask questions and to listen, but I don't have any of the tools. So the idea of slowing it down, don't let it sprint, slow down. But boy, it's easy to say that, but there are all kinds of potential consequences. Our reputation may be on the line. We got people going, it's intertwined with neoliberalism and late capitalism. Hey, I'm paying this dude money. What's he doing? Nothing's happening. And so it's easy to say, hey, as a therapist, slow down. But boy, from what you're saying, and I couldn't agree more, we have to tolerate a whole bunch in order to actually slow down.
Yeah. Yeah. We have to carry what I would say in every other area we're socialized not to carry. Like reputational damage is associated with not doing a good job at work. It's associated with then having reduced income and then being in a position where maybe you can't take care of the people that you love. Protecting your reputation in every other environment, I'm not saying it's good, but I'm saying it's understandable how people become obsessed with this because it's so tied to safety. And I think in therapy, we have to drop that part of our socialized self and enter into something that requires a process and something that, yeah, doesn't sprint but walks and that isn't immediate and uh, outcome driven. It's not algorithmic, right? It's not the dopamine feed. It's a slow, deliberate, thought through process, but that's how all transformation or change occurs. And I'm always sort of suspicious when I meet people and they go on a retreat or they go on like a weekend trip and they come back and they go, I'm fundamentally changed. And I'm like, well, I'll talk to you in 3 weeks. Like you can hold on to that for a little while. But in my mind, I'm like, change happens in inches, not in feet. And I think it's something that requires constant self monitoring and intention. And a lot of times we're not working to make 180-degree changes. We're trying to make like 10-degree changes that over a long enough period actually come up, they amount to huge differences in outcome in life. And so I just think waiting and going slow is also way more consistent with an authentic model of how we change. And going fast and showing up and saying, "Hey, like, please give me the fix." There's plenty of people who probably market themselves that way, and perhaps they are just more successful or talented than I am at this. I'll leave that door open potentially. There are people who are just really good in really short spurts. But for me, I think this is a process where change is slow and hard fought, and it happens in inches, but those inches make the difference. And so, in order to sort of walk down that path, it really requires clinical waiting and understanding that our clients temporarily might not love that.
What have you learned about how to move slower?
Mm. I think one of the things I try to pay attention to is in the privacy of my own mind, how quickly my conceptualization is becoming concrete. I think there's also something emotionally regulating when you go, aha, I've got it. And so I think part of it starts with resisting the relief that comes from insight. And that isn't to say we can't have insight. It's just to say that moment where you go, oh, I know what I'm looking at. I try to be sort of suspicious of that and to sort of come to that over time. I also think I try to set realistic expectations about what therapy is with clients at the beginning. And I really try not to provide the expectation that, in the short term, things are going to be radically different. I try to forecast and provide like a sense of what the process will be. And I think ultimately slowing things down is about making myself more uncomfortable. And typically, what I've understood is that the clients become more comfortable with that they need time to explore the unexplored and time to get a sense if I'm the person for them. I think eh, people come to therapy. It's a little trite to notice this at this point, but people come to therapy with like their explicit goals and then they have like implicit goals or, I think I could address this, but is this the kind of person I could talk to about these other things that I hide from everybody? And I think when we slow things down, it actually creates space for the client to answer that question and to say, maybe this is the person I could trust with this. Maybe this thing that I keep hidden, I can bring it forward. So it's not just that good therapy requires slowing down, it's that our clients need time to know if we're the one that they can address their suffering with. And so a part of it is just reminding myself that if I move with too much speed, I might reduce the chance for the client to ask themselves if I'm the one that can help them.
And just like that, an hour has melted away. Um, Gosh, I really enjoyed this conversation. I'm wondering if folks have interest in learning more about you, the work you're doing, maybe some of the writing you've done. Is there some place they can go?
Yeah. So my website's just my first and last name, davidprucha.com. And, or if you can bear it, I'm on LinkedIn, although that landscape is challenging in its own ways. There's a lot of self promoting going on. I try to keep that to a minimum just for my own soul. But you can find me there and say hi. And then a lot of the writing that I've done is on psychotherapy.net. So you can check me out there. There's also a couple of other articles that are coming out specifically about what we just talked about, both the compassion blocking and the appraisal bailouts.
I'm very much looking forward to reading those myself. Thank you for the time. Let this not be our last conversation.
Yeah, I would love that. This is awesome.
All right. Take care.
Yeah.